Hi, I am Dr. Nagarjuna Maturu, a consultant in pulmonary medicine at Yashoda Hospitals, High Tech City, Hyderabad. What are the treatment options for an ILD? So, there are several ways in which ILDs can be treated. The most important thing is medicines. So, the earlier you diagnose, the better it is, because you can control the disease much better. So, broadly speaking, there are two different types of interstitial lung diseases. One is called as an inflammatory ILDs, second is called as a fibrotic ILDs. Sometimes you can have combination of both. So, inflammation means there is lot of immune cells, inflammatory cells in the lungs, and they cause the disease. So, for an inflammatory ILD, the main treatment is steroids and other immunosuppressive medicines. This is very common. Several ILDs fall into this inflammatory ILDs. Second, fibrotic ILDs. Fibrosis means scarring of the lungs. So, the lungs will become thick and scarred. So, for fibrotic ILDs, you have medicines called as anti-fibrotic medicines. Currently, there are two medicines which are available. One is called pirfenidone, second is called nintedanib. So, this is how the medicines can be given. Again, many times you will have combination. So, you give a combination of a steroid and antifibrotic also together. This is a very broad overview of the types of medicines. Again, depending upon the pattern of ILD, sometimes you also have certain injections which can be given. So, a lot of other things can be done for ILDs. So, this is the medical management. But what is important is, in addition to medical management, there are certain other things which you have to understand. Second very important thing for ILDs is what we call as rehabilitation, pulmonary rehabilitation, which means that certain exercises to keep your lung healthy. So, these are taught to the people of ILD. So, you have physiotherapists who will teach exercises to strengthen the chest wall muscles, to improve the lung capacity, to improve the functioning of the upper limbs and the abdomen. So, by doing these exercises, you can actually improve your survival also. So, this is very important, that is rehabilitation. Third is prevention. So, it is very important that you treat, but you also prevent the cause. As I have said in my previous video, the causes of ILD: smoking, occupational dust exposure, pigeon feathers, farm dust exposure, all of these are preventable causes. So, if you diagnose someone with a smoking related ILD, obviously you have to stop smoking. If you do not stop smoking, the disease will worsen. Similarly, if a person is working in a mine and develops pneumoconiosis, then he should stop going to the mine, only then his ILD will stop worsening. If you have a person who has ILD because of pigeons, then they should take all precautions in the home to prevent pigeons from coming. So, the third important aspect treatment of ILD is to stop the exposure to the culprit agent. You have to identify the cause and remove the cause from the person's environment. This is again very important. And lastly, suppose you diagnose very late, or there are certain people where even though you give treatment, it will still progress. So, the last option which you have is lung transplantation, which is there in India now, and you have several centers doing lung transplantation. So, if you come to a stage where the oxygen levels have fallen down, where the person is not able to live a good quality of life, then you can also offer lung transplant as a treatment option for this interstitial lung diseases. You can follow our page for learning more about pulmonology and for further information.